Every week, I have patients who come to my office who say, first thing when I come in the room, they pinch the skin right here and they say, I want to get rid of all this extra skin. The next breath, they say, I'm really worried that if I have upper eyelid surgery, I'm not going to be able to close my eyes afterwards. So what do you do with that information? I think that highlights a really important point about upper eyelid lift surgery. You want to be able to restore the natural aesthetic appearance so that people can wear makeup, wear mascara, wear eyeliner, or just see their eyes better. But you don't want to veer off into where you don't have a fold there, and that's where you can run into problems with closing the eyes. Let's dive into this. If you're new to our channel, I'm Dr. Kian Eftekhari. I'm a board-certified eye surgeon who specializes in oculoplastic surgery. So there's a natural desire to want to get rid of that heavy, hooded eyelid look. And that makes sense, because when that extra fold of skin touches the eyelashes or comes close and kind of hangs down, the natural thing people do is they raise their forehead to try to compensate for that. And then you're in this constant cycle of wanting to raise your forehead. Now you're getting forehead wrinkles, but it's really because you have that extra skin that's hanging down. So it's understandable that my patients come to me and they kind of pinch that skin and say, this is my solution. I want to get rid of this. Makes sense. Problem from an eyelid surgeon's perspective is that you need to have extra skin in your upper eyelid. You don't necessarily need to have that much extra skin, but you need to have some. Because basically all of us, whether we know it or not, we hold in reserve some extra slackness of the skin in the upper eyelid. Sometimes that gathers into a fold, like it does in most people. Sometimes it's just kind of evenly distributed, like it is in mine. I don't really have a distinct fold. Either way, you have to have some extra skin up there so that when you blink and close your eyes to sleep, that there's no tension on that area. And I have seen that, unfortunately. So what is the goal? Is it just to hack away and remove all the extra skin? Well, no, it's not. The goal is increasing something called tarsal platform show. What that means is basically we want to increase the distance between the eyelashes and where that skin fold starts. So in most people that come to my office, it's on the eyelashes or near the eyelashes to where they can feel it. Especially out here laterally, we want to increase that distance so that you get a little bit of peripheral vision back, but also you just feel like there's less baggage or heaviness on the upper eyelids. I tell a lot of my patients, especially my male patients, that it's almost like you have a brim of a hat just sitting on there at all times that you just kind of catch out of your peripheral vision. Tarsal platform show is interestingly why people have tried eyelid tape to try to help this, because it addresses the exact same thing. It's trying to get a little bit of distance between the eyelashes and where that fold starts by putting that piece of tape just in between the lash line and your natural crease. So there's a harmony between what you're trying to achieve aesthetically with eyelid tape as what you're trying to achieve with eyelid surgery, which is increasing that tarsal platform show. The question is, how can you do that safely? So the way an eyelid surgeon looks at an upper eyelid lift is I look at where your natural crease is, because that's where I want to start the amount of skin removal. And then I have people close their eyes before surgery, have them sitting up, and I actually pinch what I can pinch away without inducing a lift or an opening of the eyelid. I want to see where I can pinch the skin before it causes somebody's eyelid to open. And that's where I know how much skin is safe to remove with upper eyelid surgery. There's other factors that go into it. Sometimes people have a heavy brow, and if I pull that skin away, I'm just going to kind of pull the brow down. That's when we talk more about a brow lift, if your surgeon mentions that. And sometimes people have a problem with a muscle where the eyelashes are hanging too low. That's something called ptosis. But if we're just strictly talking about removing skin on the upper eyelids, it can be done very safely as long as you respect the fact that all of us need to have some left behind to close our eyes. And when our eyes are open, that still might gather into a fold. The goal is to have the fold be higher up and out of the way, closer to the eyebrows, to increase that tarsal platform show. So if you're thinking about upper eyelid surgery, if you have any questions, leave some in the comments. The question you want to ask your surgeon is, how are you going to restore my natural appearance, whether that's having a fold, just having it higher up, or not having a fold like I do, and how are you going to keep me safe to where I can close my eyes after surgery? That is the critical tension of upper eyelid lift surgery, and it's really important to understand what our goal is as eyelid surgeons versus what you might be perceiving the goal is when you pinch that extra skin. If you'd like to learn more about eyelid surgery, please comment at the bottom here. Let us know about other videos you'd like to see or subscribe to our channel. If you also would like to get more information about our practice, our website is eyelidcenterutah.com.